severe anemia, it sounds pretty simple, doesn't it? Just not enough red blood cells. But when your body is really short on those cells, the ones carrying oxygen, everything just, well, it struggles.
It really does. Think about your heart, your brain. All your organs are basically starving for oxygen. It's a dangerous state.
Absolutely. And normally our bodies have this amazing system, right?
Yeah, exactly. It relies on hemoglobin, that protein inside red blood cells.
Like tiny little oxygen taxis.
That's a great way to put it. Efficient little taxis delivering oxygen everywhere.
Yeah.
It works beautifully most of the time.
It's like what happens when the taxi company goes bust? You know, when hemoglobin levels drop dangerously low, say below 6 grams per deciliter.
Well, then the delivery network breaks down. Those taxis just aren't running in enough numbers. And your tissues, they start building up what we call an oxygen debt because they're simply not getting what they need to survive.
Okay, so the system's failing badly. Now, what if someone's in that critical spot needing oxygen now, but they can't get a blood transfusion?
Right, and there could be various reasons for that.
Like complex medical issues, maybe, or deeply held religious beliefs.
Exactly. Or sometimes, blood just isn't available immediately. It happens.
That sounds like a massive problem, a real challenge.
It is. It brings up a really fundamental question. How do you rescue those oxygen-starved tissues when the go-to method, transfusion, is off the table?
And that's what we're diving into today, right? Looking at hyperbaric oxygen therapy, HBOT, as a, well, maybe surprising alternative in these tough situations.
Yeah, and what's really interesting about HBOT is how it works. It essentially bypasses the need for those red blood cell taxis altogether.
How does it do that?
It uses physics, really, basic physics. You can dissolve much, much more oxygen directly into the liquid part of your blood, the plasma, if you just increase the pressure around the body.
Ah, okay. Kind of like forcing the fizz into soda pop under pressure.
Exactly like that. Normally, plasma carries very little oxygen on its own, but if you put someone in a special hyperbaric chamber, breathing pure oxygen at, say, 2 or 3 times normal air pressure.
Suddenly, the plasma itself gets loaded up.
Precisely. Loads of oxygen dissolves right in, and that super-oxygenated plasma can then travel around and deliver vital oxygen directly to the tissues, even without enough red blood cells doing the job.
That makes sense. So this becomes really important when transfusions aren't an option. You mentioned medical reasons.
Yeah, sometimes transfusions themselves carry risks, especially if you need a lot of blood. There are things like TRALI, transfusion-related acute lung injury.
Sounds serious.
It can be. Causes breathing problems. Or taco transfusion-associated circulatory overload, which is basically overwhelming the heart with too much fluid volume. So, avoiding transfusion can sometimes mean avoiding these kinds of complications, too.
Okay, so it's a useful tool, but is this just theoretical, or does it actually work in practice? Is there good evidence?
Oh, it's definitely not just theory. The idea's been around for a while. Animal studies, going back decades actually, have shown pretty consistently that using HBOT improves survival in, severe bleeding models.
And in people.
Yes. And we also have numerous human case reports, case series too, published over many years. They describe successful uses in patients who had severe anemia but couldn't be transfused for whatever reason.
So where does it stand in terms of, official medical guidelines? We know giving regular oxygen is standard.
Right. Giving oxygen through a mask at normal pressure, that's called normobaric oxygen, is a class 1 indication in resuscitation. It's fundamental.
The first thing you do.
Pretty much. Hyperbaric oxygen therapy for this specific situation, severe anemia without transfusion, is considered a class 2B indication.
Class 2B. What does that mean in plain English?
It means it's not necessarily the automatic first step like standard oxygen, but it is recognized as a useful and acceptable option based on the evidence we have. It's a reasonable choice, especially when transfusion isn't possible.
Got it. And how is it typically used? Is it a one-shot deal?
Usually no. It's more often used as a bridge therapy to buy time.
A bridge, okay.
Yeah, the patient goes into the chamber, breathes that high concentration oxygen under pressure for maybe 3 or 4 hours at a time.
And they might do that multiple times.
Often, yes. Maybe several times a day. They usually have short breaks, breathing normal air in between sessions, just to prevent any issues with oxygen toxicity.
And the goal is?
The goal is to keep the body's tissues supplied with oxygen using that super-oxygenated plasma, while doctors work on fixing the underlying cause of the anemia And crucially, while the body gets a chance to start making its own new red blood cells again.
So you need other supportive stuff too.
Absolutely. That's
Yeah.
why things like giving iron, vitamin B12, folic acid, the building blocks for red blood cells are so important alongside the hyperbaric therapy. Good nutrition, too.
Makes sense. What about safety and cost? Is it super expensive or risky?
Generally, the side effects are few and tend to be mild. Compared to some other major interventions, it's relatively safe. And cost-wise, well, surprisingly, a single HBOT session often costs about the same as just 1 unit of packed red blood cells.
Really? That's interesting. Okay, so let's kind of wrap this up. Hyperbaric oxygen therapy. It's essentially a lifeline, a bridge.
That's a good word for it, a bridge.
Buying time and delivering oxygen dissolved directly in the plasma when someone has life-threatening anemia, but a blood transfusion just isn't possible.
Yeah.
For whatever reason, medical, religious, maybe just availability.
Exactly. It really shows how medicine can find creative ways to meet the body's absolute need for oxygen, finding a different pathway when the main one is blocked,
Yeah.
giving the body that critical time to recover or respond to other treatments.
It really underscores how fundamental oxygen is for us, and how knowing about physics and physiology lets doctors come up with these, well, pretty clever solutions in really dire straits. It makes you think, doesn't it? What other sort of unexpected tools might be out there or waiting to be discovered for managing critical situations when the usual methods just aren't enough? What other possibilities could this kind of thinking unlock?